What is this instrument? What is this thing? It's a projectometer. So a projectometer is a device that I've been using for rhinoplasty to really achieve accuracy. I want to sort of have you understand when I'm doing a rhinoplasty, there are two components to a rhinoplasty. One component is the artistic side, and that artistic side allows me to visualize what I want. It allows me to look at what I'm doing to make sure that it looks like what I'm trying to achieve. And then it allows me to achieve that goal by seeing that everything is in harmony from the tip and the bridge to the sides and everything is correct. The problem with an artistic eye is that the patient is slightly swollen, they're slightly supine, or they are supine, they're lying flat, and there's a little bit of changes that you have to sort of mentally capture. And the way to do that is using some accuracy using this device. So what this device does is that this portion right here is actually to the incisor teeth. It's placed right to the teeth, so a hard architecture that's not going to move. And this portion is to the forehead. So you have the exact same stable measurements. Then I release this area and I move it to the infratip. I release this area and I put it right to the infratip. The infratip is the area below the tip of the nose. Then this portion here is at the tip of the nose, the infratip nose. This is on the tip. This is the rhinion, which is the highest point right here, and then the radix, which is the very top portion here. And by having them all placed before I put any lidocaine in, I already have a visual of what I want. I have the photographs in the room, so I know this is what the person starts with when I'm beginning the procedure. As the procedure proceeds, as I start developing the tip, as I start developing the bridge, I will start to see, okay, well, this looks good, but what I was really hoping for is about a 2 millimeter change in the projection and a 2 millimeter change in the rotation. Have I achieved those goals? So I put it down on it, and if I'm off by a millimeter or two, I can reposition the sutures to make that adjustment. Now, sometimes, I'll be very honest with you, I will look at the result on the table, and that 2 millimeter change, if I move it to 3 millimeters, doesn't look as good. And so this is why measurements are very important, but they're not everything. And I think that measurements, if you get captured and captivated by measurements and your eye tells you something else, I always listen to my eye. But the measurements truly do help me because I want to make sure I'm not way off in my design. It's the same way when I do hair designs. I'm always measuring symmetry, but my eye will tell me why something is off. Now, just like with the hairline where the hair slopes backwards, the nose slopes in different directions, and there's a composite. The eye, in my opinion, doesn't lie. It gives me a better composite of understanding of how the tip, the bridge, the sides all are in harmony. But this is an incredibly important device that helps me bring the left and right sides together to achieve a harmonious result that makes sense to the patient and makes sense in terms of, I'm talking about the whole results. And I always compare that against what's on the screen. So I have a very large digital projected image of the patient. I've got my notes that detail how many millimeter change I'm looking for. I've also got the patient on the table, and I've also got my projectometer in my eye. You know, I do a portrait painting, or I do a painting all the time. I'm now working on 2 portraits, one of my son and one of my daughter. And it's very interesting is that I've learned a few lessons as I do portraiture. I've done this for many, many years, is a few things. One is to do a sketch. So what that means is set a position which looks relatively good. Don't spend an hour making something perfect and then going back and looking at it and said, man, that doesn't look good. Like recently I did my daughter's portrait and I was off by a few millimeters on the eyes, and when I was very close and looking at it, it looked pretty good. And then when I stepped back, it looked off. I could tell I was a few millimeters off, and it actually threw the whole thing off. It just did not look right. So when I do a rhinoplasty, it's the same thing. I first set the position of what I think this is going to look good as a tip. I put usually a cardboard template to create the position I want. And then I step back, I secure it with one single suture, I look at it and see, is this what I want? And then if that looks good, then I further refine it, check it with a projectometer, and then progress. So just like portraiture, you do sketch work, and then you get closer and closer to the final result. Instead of spending, when I'm doing portraiture, a day painting the perfect eye, which I've made that mistake, and then realizing that eye is off by 4 millimeters and the whole face doesn't look right, and then I have to go back and erase the whole eye. And then when I fix the eye, it screws up the nose, which screws up the mouth, and everything gets off. So same thing with the rhinoplasty. You want to create a sketch work, a general position of where that nose should be. Then you want to step back. You want to really walk away from the nose from a distance, look to see if it fits the face and structural, because I'm using 2.5 magnification when I'm operating, and so that creates a distortion. It creates a crystal clear view of everything, but you want to be able to step back and look and go, oh, is that working? And then you want to walk around it. So it's the same thing when I do a portrait. I don't only walk back, I actually look at it from tilt down, side to side. I walk around the portrait. And he said, well, wait a second, a portrait is two-dimensional and your nose is three-dimensional. I understand, Dr. Lam, why you would walk around a three-dimensional object, because it does change, but why would you walk around a two-dimensional portrait painting? And the reason is that when I'm painting, I'm actually on a slight tilt, and that can also throw things off. So when I want to look at a vertical change, and what's really interesting I've noticed when I look at portraiture is that when I look at an angle side to side or tilt down to up and down, it can actually throw off proportions. So I want it to be in harmony from a frontal position, but also top, side to side. So even two-dimensional work has that level of harmony. So I think that this concept, which is really marrying artistry with accuracy, is a way to achieve good work when you're looking at artistic endeavors. And so this is why you need to have an artistic surgeon, but also one that is using technically precise parameters to achieve those goals.